Radiographers at 35 NHS trusts in England are going on strike. They are on strike now, actually. It started, 36 minutes ago. They voted to reject the government's 5% pay award. They've called for talks to reopen after other public sector workers, including junior doctors, obviously were offered more. The junior doctors, remember, holding out for 35%. Now, the Society of Radiographers says that they have worrying numbers of staff leaving the profession, and not enough is being done to recruit more workers. So, as I said, it will involve 35 NHS trusts. These include the Royal Marsden Cancer Hospital in London, the University College London Hospitals, Liverpool, Nottingham, Bristol, Western and Sheffield teaching hospitals. They go on to say 9 out of 10 NHS patients are supported by radiographers who carry out X-rays, MRIs and CT scans, ultrasounds and breast screenings, as well as radiotherapy for cancer patients. Now, they have said they will offer life and limb treatment, which means essentially emergency cover only. I'm delighted now that Dean Rogers joins us. Good morning to you. Dean, are you there?
I am. Good morning.
Good morning. It sounds very exciting and noisy wherever you are. Just in terms of this, it will be greeted with cries of disappointment, I think, around the country. Yet another NHS strike, yet more people demanding more money from an NHS which has never had so much money.
I'm not sure that the maths of that add up, actually. I think this is part of the... it's part of the difficulty of... The NHS has been... sorry, I'm up. Right. So, sorry, the question was...
So the question is, why are you doing this? And in terms, just set out for us why you're doing this, why you feel it's really important.
So... this has been building up. None of our members want to be on strike. This is the first time the Society of Radiographers have ever gone out on strike on our own in 103 years. This has been building up because of underinvestment in the NHS for 15 or so years. Every year, the demand for scans and the demand for radiography has gone up by double what the extra additional resource coming into the health service. And ultimately, we need to face up to some basic reality. If we want a world-class health service in the 21st century, we've got to be prepared to pay for it. And at the moment, the government is spending nowhere near enough on health and social care.
How much do you want them to spend?
Well, before COVID, before the pandemic, Britain was spending 40 billion a year less on health and social care than the EU 15 average. There was a pretend going, a kind of emperor's new clothes going around all the political parties that the NHS had never had so much money and that things were going so well. But modern healthcare is expensive. Now, we're not saying that we need all of that in one go. We're not saying that you can make up for 15 years of underinvestment in one go. But we do need a sign of hope. We do need a signal of hope, and we do need a government to recognise that there needs to be a long-term workforce plan and long-term investment.
But I think the government does know that. They've unveiled a 15-year plan. I'm just looking at the figures now from the British Medical Association. They say around 11.9% of GDP goes into the NHS.
Yeah, and that's less than France, that's less than Germany, that's less than most...
We're roughly the European average.
Well, I'm afraid I dispute the figures. We're not actually at the EU average. We were 40 billion less than the EU average before the pandemic, and we've not remembered to make that money up would take about 20 years of the government's increase at the government's current rate.
So what are you asking for? What are you asking for in terms of a pay rise? How many percent?
Radiographers have had year-on-year pay cuts for 15 years. Our members' pay has gone up by half the average of the rest of the total across the total economy in those 15 years. We're asking for a reasonable amount now, not another year's pay cut, and a commitment from government to a long-term plan for pay restoration.
But what sort of percentage would assuage you?
So, well, I can't understand for a second why the NHS is worth less than the rest of the public sector, for a start. So everyone else in the public sector has now been offered more than we've been given. So that would be a start. Then what we're saying is we want a long-term commitment. We want to take the politics out of NHS pay by sitting down with governments of whichever shade and working out a plan so that every year radiographers and the professionals in the NHS will have an above-inflation pay rise so that they can get back over time to where their pay was in 2008.
So let me just jump in there. Let me jump in there. The majority of unions on the NHS Staff Council actually voted to accept the government's fair and reasonable offer. They say, this is the government, of 5% plus 2 significant one-off payments of 1,655%. If you're turning that down, what do you want?
Well, I don't think half inflation for another year is a fair and reasonable...
But what about the private sector, where people are struggling, where they haven't seen their wages going up, where they actually lost their businesses?
Of course, the economy is in difficulty for lots of reasons. We're coming out of the pandemic, Brexit, etc. But if the country wants a world-class health service, we have to be prepared to pay for it. If you've got an NHS that's dependent on a skilled workforce that's in short supply, what private sector company would think that the strategy would be to pay those people proportionately less year on year and then just tell them to stop moaning? That's not the way to run a business. That's not the way to solve a recruitment and retention crisis.
Isn't the real issue here that actually our outcomes are terrible? We don't have enough staff. The money is going in at the top. It is being leaking out into layers and layers of management, which I know you will understand as well as a radiographer. And actually, I don't know how much more the public can take of this. At the end of the day, they are paying for a service they're not getting.
I would agree with a fair bit of that. I think actually one of the problems with the NHS is the lack of focus on management, the panic management and the panic crisis management on a day-to-day basis. But seeing a workforce and a work environment that's just unsafe for patients as well as staff. We've got, because there's not enough recruitment and there isn't a workforce plan to recruit the workforce now, the government's plan was about a recruitment plan for the future. There's a missing chapter of what they need to do now. We've got members who are leaving because they're overworked and overstressed. Members who are leaving because the job isn't what they trained for. People working in cancer centres who are leaving heartbroken because they're having to see patients who've been waiting too long. Patients are suffering every day because the NHS is not being run properly and there is no long-term workforce strategy, and governments are not talking to the staff and the professionals who know how to solve the problems. Absolutely, that's fundamentally what this is about. This is a strike as much for patients as it is for our members.
Just in terms of how this plays out, though, the government has said it will not negotiate. This is a final offer. How long are you prepared to strike for?
Well, governments have said that before. Government told us back in November that they weren't prepared to negotiate. Then they negotiated. They said that was a final offer and they couldn't afford any more. Then they went to the rest of the public sector and offered them more. They've still got to negotiate a way out of the consultants and the junior doctors dispute. So this is an unnecessary strike. The members behind me don't want to be on strike and have never been in this position before. If the government are prepared to sit down and talk to us about finding a long-term solution to the workforce crisis that is real every day, then we'll very happily sit in the room and we wouldn't need to be on strike. But whilst the government ignore their workforce, we have no option.
What does the average radiographer get paid?
The average radiographer earns around about $40,000 a year.
Sorry, how much?
Around about $40,000 a year.
Okay.
Which for a graduate salary and 10, 15 years worth of experience is not a huge amount of money. What we're also seeing, given that we need to probably put 30 to 40% into the workforce by 2040 to meet rising demand for radiography and rising demand for scans, we need to attract more people in. And the starting pay for a radiographer, a graduate radiographer, is barely more than they could earn in Tesco's. We've got people leaving the profession because the only option they've got to pay their bills, earning less than $30,000 when they start, the only option that they've got is either to work excessive overtime and burn themselves out, or leave the profession and find a better job.
Dean, very good to talk to you. Thank you very much indeed. That's Dean Rogers, Executive Director of Industrial Strategy at the Society of Radiographers. Radiographers on strike for 48 hours, started 46 minutes ago.